from across the globe in order to facilitate cashless inpatient service, emergency medical evacuation, second medical opinion, appointments, air ambulance, and many more. Furthermore, GD Assist is the country's only ITES company working in the space of third-party administrator for health insurance. This is still a very confusing point in our country also, because universal health coverage has already introduced to our country, but many people are afraid of this insurance thing. GD Assist, they are trying their best to rebuild our health system with the finest policies supporting most advanced technology and service-oriented healthcare provision. So let's see what we can add to this chronicle today. So may I request Mr. Syed Moinuddin Ahmed, MD of GD Assist, to please come over the stage and deliver the welcome note, please.
Thank you, Dr. Natasha. Assalamu alaikum and very good afternoon to you all. GD Assist came into the picture in 2015. It has a story behind it. The story is very simple. Amader common people's story. প্রতি বছর বাংলাদেশ থেকে অফিশিয়ালি প্রায় 20 লক্ষ লোক দেশের বাইরে যান ট্রিটমেন্ট নেওয়ার জন্য। এটা কনসেন্ট্রেটেড হলো ইন্ডিয়া, থাইল্যান্ড, সিঙ্গাপুর অ্যান্ড এই তিনটা দেশেই মোস্টলি 2014-15 তার মধ্যে কাজ শুরু করি। তখন আমরা দেখলাম যে এই যে 20 লক্ষ লোক অফিসিয়ালি, আনঅফিসিয়ালি হয়তো আরও 10 লক্ষ লোক, 30 লক্ষ লোক বিদেশে যাচ্ছেন, এদের মধ্যে কত পার্সেন্টই খুব নলেজ নিয়ে বিদেশে যাচ্ছেন। যেটা বুঝাতে যাচ্ছি যে হ্যাঁ ঠিক আছে, আমি হয়তো কোনো একটা দেশে কোনো একটা হাসপাতালের নাম শুনেছি, আমার কিছু হলো আমি ওখানে চলে গেলাম, কিন্তু নট নেসেসারিলি ওই দেশের ওই হাসপাতালে যে ওইটারই কোনো একটা স্পেসিফিক ডিজিজে স্পেশালিস্ট আছেন, এটা কিন্তু আমরা রিসার্চ করি না। যে কোনো ডেভেলপ কান্ট্রিতে যেটা হয়, পিপল ডু লট অফ রিসার্চ, অনলাইনে হোক বা যেভাবেই হোক, টু ফাইন্ড আউট ওয়ার দি রাইট ট্রিটমেন্টস আর অ্যাভেলেবল অ্যান্ড অ্যাফোর্ডেবল। সো আমরা দেখলাম যে বাংলাদেশ থেকে যে এই যে বিপুল পরিমাণ লোকজন যাচ্ছেন বিদেশে, তাদের অনেকেই কিন্তু ডিরেলড হয়ে যাচ্ছেন, তাদের অনেকেই কিন্তু একটা ম্যাল প্র্যাকটিস সিন্ডিকেটের পাল্লায় পড়ে যাচ্ছেন। ইভেনচুয়ালি কী হচ্ছে, সে জমি জমা বেচে বিক্রি করে বিদেশে যাচ্ছেন, কিন্তু রাইট ট্রিটমেন্টটা পাচ্ছেন না, টাকা চলে যাচ্ছে, সর্বস্ব চলে যাচ্ছে এবং ইভেনচুয়ালি হয়তো ট্রিটমেন্টের অভাবে উনি মারা যাচ্ছেন। সো এই জায়গাটাকে অ্যাড্রেস করার জন্য দেশের স্বনামধন্য গ্রিন লেটার ইন্স্যুরেন্স কোম্পানি ডিসাইডেড যে লেটস ইন্ট্রোডিউস হেলথ ইন্স্যুরেন্স, অ্যাট দ্য সেম টাইম লেটস ক্রিয়েট অ্যান ইকোসিস্টেম সো দ্যাট এই হেলথ ইন্স্যুরেন্স নিয়ে যদি কেউ বিদেশে যায়, তারা যেন প্রপার একটা সার্ভিস পায়, রাইট একটা জায়গায় গিয়ে রাইট ট্রিটমেন্টটা নিতে পারে। সেখান থেকে জিডি অ্যাসিস্টের যাত্রা শুরু। আমরা শুরু করি মেডিকেল ট্যুরিজমে মালয়েশিয়া দিয়ে। মালয়েশিয়াকে আমরা সবাই জানি যে লাঙ্কাউই, টুইন টাওয়ার এইসব বিষয়ে জানি, কিন্তু আসলে মালয়েশিয়া ইজ ভেরি অ্যাফোর্ডেবল অল্টারনেটিভ ডেস্টিনেশন ফর ট্রিটমেন্ট অ্যাব্রড ইন এডিশন টু ইন্ডিয়া, থাইল্যান্ড, সিঙ্গাপুর। সো আমরা মালয়েশিয়া নিয়ে শুরু করি, বাট ওভার এ পিরিয়ড অফ লাস্ট 5 years we have converted ourselves into a healthcare management company, whereby we try to provide a lot of value-added services in the healthcare space and trying to create an ecosystem whereby we can make our international standard healthcare facilities affordable. Etar maneta ki? Maneta holo je amra kichu value-added services create kori, tar moddhe ekta holo getting discounts, arekta holo health insurance, আরেকটা হলো প্রিভেনশন, আরেকটা হলো ওয়েলনেস প্রোগ্রামস। এই জিনিসগুলিকে আমরা একটা বাস্কেটে নিয়ে এসে আমরা চাচ্ছি প্রমোট করতে অ্যাজ ইন এ ওয়ে সো দ্যাট আমি আসলে সুস্থ থাকবো, সেই অ্যাওয়ারনেসটা আমার থাকবে, আমার কোনো কিছু রোগ হওয়ার আগে আমি প্রিভেন্ট করব, অ্যান্ড গড ফরবিড যদি আমার কোনো কিছু হয়েই যায়, আমি যেন ভালো ডাক্তারের কাছে যেতে পারি। বাংলাদেশে অনেক ডাক্তার আছে যাদের ধরেন 3 মাস 6 মাস অ্যাপয়েন্টমেন্ট পাওয়া যায় না। সো আমাদের যারা ক্লায়েন্ট তাদের জন্য কিন্তু উই ফ্যাসিলিটেট দিস সার্ভিস। বাংলাদেশে 100টা হাসপাতালে উই ক্যান রিয়েলি ফ্যাসিলিটেট দিস অ্যাপয়েন্টমেন্ট প্রিটি কুইকলি। সো ভালো ডাক্তারের কাছে যাব, ট্রিটমেন্ট যখন করাবো we'll get discounts, both inpatient, outpatient. Not only this, এই সার্ভিসগুলি আমরা বিদেশে হাসপাতাল থেকেও প্রোভাইড করছি। So as a whole, একজন individual, একজন client of GDSs will get lot of services to remain healthy as well as wealthy in terms of savings and discounts. So before further ado, I once again thank all of you for coming down here and attending this event, and let us hope for the best in the future in terms of a healthy nation. Thank you so much.
Thank you, Moin Bhai. Now we will have some formalities related to the MOU signing ceremony between BASIS and GDSS Limited on the privilege offering of GDSS products to BASIS members. So may I call upon the dais, BASIS President Mr. Soyad Almas Kabir, and also the Chairperson of GDSS and CEO of Green Delta Insurance, Ms. Farjana Chaudhary, to please come upon the dais and complete the ceremony of MOU signing. We can have the other members also, because we can take a nice group photo. I should welcome all the other panelists also, Mr. Baba, Silvana, and Dr. Abhijit. Please come up on the dais. Thank you so much, all of the panelists up on the dais and also the audience. Can we have a big round of applause, please? Thank you. Maybe after lunch we get a bit sleepy. আমরা আমাদের MOU signing ceremony-টা শেষ করলাম। আমরা এবার একটা keynote speech শুনবো। So I am going to request Professor Abhijit K. Chattaraj. He's the Professor and Chairperson of Program for Insurance Business Management, BIMTech, India. He'll be talking on health insurance and health technology. He has a lot of experience in this sector, so we will be glad to hear from you. Dr. Abhijit, please.
Very good afternoon, ladies and gentlemen. My sincere thanks to Green Delta Company for inviting me and giving me this opportunity to interact with you today. In fact, every time I come to Dhaka, and I'm startled by the fact the way the landscape change here. And the speed at which it is changing startles me, because back home also things are changing, but not the way things are changing here. Another important thing, a big compliment to today's context, she is more popular in India. In every seminar or every important event that takes place, she is there everywhere, and almost everybody knows her and the kind of respect she commands in India. That's something I thought I'll share here. I'm basically an insurance man, and I did my studies in health insurance. Not really an insurtech man or health tech man. So there are very eminent panelists today with me, and they will be throwing more focus on it. But I will be restricting myself with my presentation about health, how things are changing, and slightly kind of thing the technology can do. Technology is considered fundamental to sustaining economic growth. The harnessing of water power, followed by invention of an efficient steam system in 1769, ushered in the first industrial revolution, which heralded the economic development in Europe. The internal combustion engine arguably sparked the second industrial revolution, while the third has been driven by computers and World Wide Web. Technologies And more broadly, innovations are therefore central to a long-term growth because of their impact on productivity, efficiency, and effectiveness. It is said artificial intelligence is ushering in the fourth industrial revolution, which will change society as we know it. As the third industrial revolution has evolved, information and communication technology structure that reconfigures all other infrastructures into a smart system that accelerates socioeconomic development. More importantly, today, as the third industrial revolution morphs into fourth industrial revolution with the Internet of Things at its core, artificial intelligence, that is machine performing cognitive technological frontier of sustainable development. As AI goes mainstream, its disruptive impacts are likely to be seen at an unprecedented speed and scale, which underlines the need for government and stakeholders to discuss and save their collective future. I come from an institution called Birla Institute of Management Technology. We run 2-year insurance course, a specific insurance course, and the postgraduate students who pass out from the institution, they join the insurance industry, which has been growing very fast, has been growing rapidly in India. I don't know, do you know some of the important facts about Bangladesh? Is anybody aware of the facts? What is your healthy life expectancy in Bangladesh? Huh? That's life expectancy at birth. So I'll show you something and you will find it's not. Look at Bangladesh. Your current health expenditure as percentage to GDP is quite high, 7.4. India is just 3.9, China is less. What I unfortunately find that current health expenditure per capita US dollar, I don't know for what reason, it's less. It's only 32, less than even India, which is 63. If you look at if the chairs are, okay. Can you change? The slide's not moving. Can you go on to the next slides? If you look at the life expectancy at birth, what we call LIVE analysis, and we find Bangladesh has been doing very well, 72.7. Look at India, we are only at 68.7. Look at SEA, SEA is Southeastern Asian region. The Southeastern Asian region is 72.69, and Bangladesh is doing better at the moment. But your healthcare system has been suffering. I don't know what are the reasons. Your physician per 10,000 is only 5. Compared to that, India is 8, China is 18. So is the nursing and midwifery personnel. It's only 3. And we look at India, we are not great, but we are even less at 21. So this is one area of concern. This is one area of worry, and this is also one area of opportunity. When your healthcare system is not supported by the kind of people who should be supporting, the question, the million-dollar question is, can InsurTech or health tech or technology or any kind of innovation, can they step in and fill up this gap? Because this looks like an opportunity, and possibly technology needs to look at it. If we move on to the next slide. Next slide, please. Okay. This is worry. Maternal mortality ratio is very high. It's 176. India is 174. This is the only area where I find Bangladesh is doing bad than India. In all other health indices, Bangladesh is far superior to India. But when it comes to maternal mortality rate, it's slightly high. And then the reason I could understand is that if you look at the proportion of births attended by skilled health personnel, it's only 50, whereas India has improved significantly to 80, but the ratio has not come down. If you look at Japan, it's only 5, because of the simple reason the proportion of births attended by skilled health personnel in Japan is as high as 100, which is very, very significant. I find that in neonatal birth and infant mortality under 5, there also Bangladesh has been doing very, very well. Somehow this is hidden here. If you look at the SEER and global rate, Bangladesh has been doing far better in both it's 34.2 in 5 under 5 mortality, and neonatal is 20.1, but even then it has been doing better than many countries. So these two areas Bangladesh has been working very, very good. When I asked this question, healthy life expectancy, Bangladesh has been doing exceedingly good. It's about 63, is far better than India at the moment. If I look at this next slide, now, this is a serious problem. Now, these are the problems healthcare can suffer. Most of the healthcare suffer because of what we call inverse care. People with most means, whose needs for healthcare are often less, consume the most care, whereas those with least means and greatest health problems consume the least. This is a serious problem all over the world. This inverse care trend needs to be changed, needs to be reversed. If it cannot be reversed, cannot be changed, health worries will increase over the period of time. So this is one area. Public spending on health services most often benefits the rich more than the poor in high and low income countries alike. The other is impoverizing care. Wherever people lack social protection and payment for care is largely out of pocket at the point of service, they can be confronted with catastrophic expenses. Over 100 million people every year fall below the poverty line because of catastrophic health expenses. What is the health protection gap? Any youngster here in the audience can tell me what is the health protection gap in Bangladesh? Or what is meant by health protection gap? In insurance, we often talk in terms of protection gaps. And if the protection gaps are high, naturally worries for the countries will be also very, very high. If we look at the next slide, we find that the care is very fragmented. But more than that, this is very important, misdirected care. Resource allocation cluster around curative services at great cost, neglecting the potential of primary prevention and health promotion. I'm always peeved by this particular issue, misdirected care. What is happening in India, health insurance, which is a 40,000 crore business in India. It's a huge business. 40,000 crore is a big amount in Indian market. But it's very much loaded towards curative care. Primary and preventive care has not really taken place the way it should have taken place in India. And that's the reason the curative care is very high, and that's the reason healthcare is extremely expensive in India. And it's likely to become more and more expensive in India. When once I was talking about taking healthcare, health insurance with India, you need to be very, very careful. Health insurance purchasing is an art. If you cannot purchase health insurance properly, you can land into serious difficulty. Because, as you said, there are rackets, there are syndicates, there's whole the hospitals and doctors, they bargain very high rates for services they give it. One of the areas where technology can really play well is how to fix the package rates when they are negotiating with the hospitals. What kind of amount should be paid to a hospital for a particular clinical exercise? I have seen in India, the biggest problem in India is that we do not have clinical guidelines. And in the absence of clinical guidelines, hospitals do what they want to do without really looking at the problem of the customers or the patient. They experiment at the cost of insurance company, they experiment at the cost of the customer. And the whole exercise needs to be reversed, needs to be arrested, or else health insurance like Obamacare in US, in India, is likely to be in serious problem. Looking at Bangladesh, things are slightly better. Your community health care is doing very well, more than really I thought. I find that the reasons why Bangladesh performs far better in various health indices is because your primary health care is possibly working much better than what it is in India. If you remember, or in the audience, in 1978, there is this place in Kazakhstan where the primary health care movement started. And they say, all over the world it is said that if you can weave your health care around primary health care, then possibly you are going to do well in health in days to come. If you fail to do that, then you tend to become, your care tend to go towards this in a way. I was looking at some of the expenditure that the Bangladesh government is making in health care that suggests that Bangladesh has been investing a lot in primary care. Coming back to technology, and if you can go to the next slide. These are some of the things that technology can give us. It can give us proper health service regulation. It can reduce the gap between urban and rural healthcare facilities. Can also make our healthcare services more affordable and secure. Healthcare digitation system, medical health records. I don't know, in Bangladesh, are you going for medical health records at the moment? Do you have any health records? In India, the government of India, because you must be knowing Ayushman Bharat, the universal health care for the 30 crore people. And we have a biggest challenge. Maintaining health records is a very challenging job. There are plenty of outfits which are coming against, is a very sensitive area. In the US, there is a law called HIPAA, Health Insurance Portability and Accountability Act. And they have very articulated norms that which health records you can preserve, which health records we cannot preserve. When we look at the innovators in India, today it's creating concern. You cannot possibly go and start getting records. The people will object. The consent that is required or which is forcibly taken, now people have started challenging it. And government of India has a real problem because unless you have health records, health services cannot become good. Health records will serve the society in a much better manner. Then possibly technology has a bigger role, how to collect health records. I was going to the next, please, go to next slide. What AI can do? Can AI reduce health risk? Can AI drive to preventive health care and management? I understand health insurance in Bangladesh is at a very nascent stage. When you do the onboarding of proposal form, what are the things technology can really do? Some of the insurance companies in India, they have a system called HRA, Health Risk Assessment. So the moment the way you fill in the proposal, they don't fill in the proposal, it's on online platform. They ask you various types of questions. And when they ask these questions, in the process, they come to know the kind of health you have at the moment. It's not only the physical health or the mental health. Today, the cultural health, the religious health, the spiritual health are very important. Say, for example, those who follow Islam, there should not be, if he's a true Islam follower and a 5-time Namazi, I don't think he should be suffering from any kind of ailment. The way you have to move your neck, the way you prostrate, if you are 5-time Namazi, I'm saying. I always tell this platform that if you are a 5-time Namazi, then you should be very healthy because your religion has that inbuilt quality It has a very inbuilt quality. It's very healthy. So when these health risk assessment companies, when I do the assessment, and if you follow a particular religion, say Islam, so I try to understand how many times you go for Nimaj. Are you a 5-time Nimaji, 6-time Nimaji, or 1-time Nimaji? And based on that, I assess the risk. So health risk assessment has become a very, very important tool in India at the moment. And most of the insurance companies who are going for onboarding health insurance proposals online, they have been resorting to health risk assessment in a big way, and it's a wonderful tool. I am sure those tools will, either they are in your country or will travel to your country sooner or later. As I spoke about electronic medical records is an important document. And what I also came to know, if you can, that, please, change. So telemedicine, telehealth, then what I found that Bangladesh government has already set up 800 computer centers with video conferencing, internet facility in semi-rural health complexes spread throughout the country. I also found that portal technology is also doing well. We have, which allows physicians and patients to access medical records and interact online. Such platforms are plenty in Bangladesh. I found that somewhat 65 strong health tech companies are there. If you go to the next slide. Then sensor and wearable technology. This is where a lot of changes are taking place, and it can do well. Sensor and wearable technology. Most of the health insurance companies have come out with sensors and wearable technology, and they are looking at your health behavior. They are monitoring it. Based on that, today in motor insurance, you know what has happened today in motor insurance? They say pay as you drive. If you drive more, pay more. If you are not driving more, pay less. Absolutely customized product. But tomorrow you will find in health area also absolutely, because of technology, absolutely customized product. If you are physically fit, you are physically alert, mentally alert, if you are doing all kind of exercises, you have to pay less. If you are not doing that, you will have to pay more. Wearables are great devices which is coming, then there are 3D printings. All these are going to make changes very well. I also found, and today, next slide please. Some of the important players, and I found that they are in the panel, they will be better talking about their initiative. Telenar Health, that's doing very well in Bangladesh. It's a digit fraud door to health that can be scaled to 10 millions of consumers across the market. So Telenar, I am not the right person to talk about because the gentleman here today is in the panel, so he will be able to better talk about his initiative. Next slide. Then Prava Health, and when I find that when I was trying to understand, then I found that this is another organization which is doing very well. So another panelist is there. She will be talking more about it. And another organization which has been doing very, very well is, next slide, if you could. This is Pulse Digital Healthcare. So I find quite a few startups, health tech companies are working in Bangladesh, and they have been doing well. But there are issues. There are plenty of issues. And one such issues I can quote from a McKinsey report, which says, half the world's job could be automated by 2055. It is valid to think if technology, instead of ushering growth, is also driving inequality. The point of concern is frontier technologies are based on huge quantities of real-time data, which are themselves critically dependent on high-speed broadband internet. The existing lack of broadband connectivity across many Asia-Pacific countries means that uptake, adoption, and development of AI and other technologies will continue to be uneven. It means The technology benefit will reach to some population, a population which is elitist, which is rich, which has the access, but unfortunately will not reach to populations which really require healthcare most. If you remember, the first point was that those who require healthcare most, they are not getting. Those who do not require healthcare most, they are using it most. So that's the challenge. That technology has the great power. It will bring down the cost. It can it can increase the accessibility. It will definitely move around the millennial population around it. But geriatric population, which is a population beyond 60 years of age, their healthcare needs are very different. Their institutional settings are different. They don't want hospitals for treatment. They are looking for home cares. They are looking for subacute cares. And those kind of facilities must travel if health has to be inclusive. What is happening in India? We are hugely dependent on hospitals. And unfortunately, hospitals are only one institutional setting. It does not, of home cares have come. And home cares are providing kind of services, they are tuned to the requirement of the geriatric population. And they work with physiotherapists. 8, 9 types of physiotherapists work with the geriatric population whose problems are mostly chronic problems. With this, I thank you all once again for giving me the opportunity to share my thoughts. I believe that Bangladesh is on the right path. Technology is likely to change the face of many things in days to come. But the only caveat is that technology need to be and must be, should be also inclusive. If technology fails to be inclusive, then technology divide, or what we call digital divide, is likely to divide this society. It will help some, but most of the other people, most of the people who have no access to internet, broadband facilities, they will be deprived of health care. Thank you so much for giving me opportunity once again.
Thank you, Professor Vijit Chattoras. Thank you so much. It was a very brief discussion, not only from India and Bangladesh, also world and especially Southeast Asia region. আমরা এখন আমাদের প্যানেল ডিসকাশনে চলে যাব। আরও একবার আপনাদের স্মরণ করে দিতে চাই, আমাদের আজকের অনুষ্ঠানটি হচ্ছে হেলথ টেক Scopes and Challenges in Bangladesh. It is presented by GD Assist and powered by Green Delta Insurance এবং আমাদের media partner Jugantar এবং Financial Express. So I would like to call upon our panelists on the dais. So may I request Ms. Farzana Chaudhary, please come up on the dais. Professor Abhijit K. Chattoras, please come up on the dais. Mr. Sajid Rahman, Ms. Silvana Qureshi Sinha and Rubaba Daula, please come up on the dais. And now we are going to start our panel discussion. And I would like to introduce myself once again. I'm Dr. Natasha Khurshid, Associate Professor of Public Health. Thank you. You can take seats. We will arrange another for chair. So as we move on to our panel discussion, let me introduce our panelist, Ms. Farzana Chaudhary. She's a chartered insurer. She's the Managing Director and Chief Executive Officer of Green Delta Insurance Company Limited. She is the first and youngest female CEO in the industry and is recognized by UN Global Compact as a local SDG pioneer in 2016 for women's economic security for initiatives through Nibedita. আপনারা অনেকেই হয়তো নিবেদিতার নাম শুনেছেন, এটি একটি ইন্স্যুরেন্স। Nibedita, which is a comprehensive insurance scheme for women since 2016. Ms. Chaudhary has been a regular speaker or panelist in the UN SDG Summit every year. She has received awards from Women Economic Forum, Onunna, EO Global, Bangladesh Brand Forum, and SARC Women Association for her progressive works in women empowerment. She has also received a very prestigious Public Trust Award from CII UK in April 2019 for building public trust in financial services and insurance. Last but not least, she is the first Bangladeshi woman to have been recognized as Woman Leader of the Year in Asian Insurance Industry Award 2019. In addition to being the CIA Goodwill Ambassador in Bangladesh, she is also a board member of CSR Center in Bangladesh and many more organizations. May we welcome her with a round. I will introduce once again our keynote speaker, Professor Abhijit K. Chattaraj. He is also a chartered insurer and also Goodwill Ambassador of Chartered Insurance Institute. He is currently the Honorable Vice President of Risk Management Association of India and Chairperson, Program for Insurance Business Management. Dr. Abhijit K. Chattaraj joined BeamTech as Professor and Chairperson at Program for Insurance Business Management. Prior to joining BeamTech, he headed Amity Business School, Amity University, and Mumbai right from its inception. He was also associated with National Insurance Academy, Pune, as a faculty member and also as chairperson, PGDM and Students' Welfare. He has more than 25 years industry experience in management and insurance teaching and training with reputed public sector insurance company and is an acknowledged trainer, coach, facilitator, mentor in health insurance and other domain of general insurance. We will learn something from him also. Dr. Chattaraj did more than 75 MDP programs in health, automobile, liability, marketing, both in India and abroad. He is also credited with many research and conference papers. Please welcome him with a round of applause. Now I am going to introduce Mr. Sajid Rahman. He is the CEO of Telenor Health. He is building the digital front door to health, serving millions of people. He is also an active angel investor who was invested at companies based out of Silicon Valley, Asia, and Europe. His experience includes building banking business, renewable energy companies, and tech companies in markets of Asia and Africa. Sajid Rahman also owned the boards of a number of companies. Can we give a round of applause for him also? Thank you. Now, Ms. Ilvana Kader Sinha, she is the founder, managing director, and CEO of Prava Health. Ms. Sinha is an attorney and entrepreneur with a decade of experience in leading diverse interdisciplinary teams in international law, business, development, and government relations, including major international law firms, management consulting firms, the World Bank, and think tanks in the Middle East and Southeast Asia. She has advised governments in Afghanistan, Middle East, and Asia on governance and legal reform, and has counseled multinational and regional clients. Ms. Sinha also served as a foreign policy advisor to the 2008 presidential campaign of then Senator Barack Obama. She is a life member of the Council on Foreign Relations and also serves as a member of National University of Singapore Medicine International Council. Thank you. And not but the least, Rubaba Dola. She is the founder and managing director of Pulse Healthcare Services. She is the president, the Indus Entrepreneur Chai. She is one of the most successful business person who has played an important role in building Telenor subsidiary Grameenphone as a #1 brand. She also holds membership in the Mary Stopes Bangladesh. Some of her innovative products have achieved World GSMA Award and acclamations because of her excellence in formulating corporate vision and long-term strategy. She has earned both national and international accolades at corporate and personal level. Thank you. Thank you so much. Now we are going to start our discussion. So welcome once again. I would like to start our panel discussion with Farzana ma'am. You have a lot of experience from the global world and also from Bangladesh. Today we are talking about the health tech in Bangladesh, but before we introduce the health tech or start our discussion from Bangladesh, we would like to know from you that what is your experience or how you express the health tech globally, how it is advancing the health system.
Thank you. Thank you very much for BASIS and GDSs for inviting and for organizing a great panel discussion on health tech technology, which is actually the critical issue that we are facing. And I'm sure from the keynote presentation of Dr. Abhijit, you've seen that nowadays every matter is becoming critical, and especially the healthcare. And in healthcare, it's such an insensitive issue that we need accurate information. And of course, the service, hassle-free service. And of course, the customer satisfaction is one of the critical areas, and getting the proper service from the proper doctor, from the proper hospitals is also important. Healthcare service is important. So it requires a one-stop service platform, and you can see what's happening globally. And he shared India experience, that how technology is actually acting as an enabler and kind of acting as a gap remover. So whatever we're seeing, like artificial intelligence, these type of technologies are actually are there across the globe. Blockchain, we're seeing blockchain, which actually gives us more transparency in the information and also the services. We see chatbots. These are already here in Bangladesh, but it's been very prominent and very visible in the developed countries. Then you see video conferencing, virtual reality. Because people are, you see all those, you see Facebook Live. Now Facebook started as a social, I would say, platform. Now it has becoming more professional day by day. You see that online platform, people are selling, buying and selling food, clothing, and of course, the medicines also. So I guess all these like advanced video conference. So these technologies are there, and I think artificial intelligence, if you see, it's going to grow more than 40%. In the years like by 2021, that will bring in revolutionary change in the digital marketing channel. So healthcare is a platform where definitely I see, and we have experienced. And there's another question regarding how we started. My colleague has mentioned why we started this platform, that healthcare management platform. When we started, we didn't think of technology. We just thought of bringing in value-added services by providing healthcare and also insurance, because insurance is a very neglected subject. But when we started with Malaysian healthcare and also arranging end-to-end service, then we actually kind of thought about it, because it came to us because people want very quick service, hassle-free, and they want to make decisions very quickly. So technology, a platform, if you have a telemedicine corner or a teleconference with a doctor, that can save time from for a patient to go to the to that country, locally or abroad. We do have video conferencing. So these are the things that it came out from the service, and then we have kind of went forward on our e-portal services, that we kind of we render services where through payment integration. We do have cashless insurance service, where people have hassle-free insurance when they travel abroad. They travel with a free mind. That we do have aligned healthcare services and the evac. All these information that it's provided to our healthcare services. So through our subsidiaries, we are trying to create a one-stop service platform in the healthcare, where technology, we're trying to bring in more technology. We are partnering with organizations like Prava Healthcare. We have partners with startup techs. Few startup techs are our partners, where we do appointments. So I think in this area where we are trying to kind of bring in less time consumed, less time involved in end-to-end medical service, and for that reason, accommodation, because if you see globally, there are Gap Flow, there are Medigo, there are all these big startups who are bringing in one-stop service platform in terms of patient, doctor appointments, accommodation, air tickets, everything together. So this is a platform that we are also trying to bring in through an app as well, so that it can create a environment, an ecosystem where healthcare would be a one-stop away. Not only also in Bangladesh, but also in other countries. So I think if you see in the developed world, insurance is also aligned with, attached or aligned with the wearables, where we don't have it here as well. Because health insurance is another word, it's very much, I would say, a neglected sector, where people don't talk about insurance because of the trust and confidence.
Yes, they do trust.
Yes.
I have the excess.
So that's why you heard that we have awarded with the best, the Public Trust Award. So trust and confidence comes with the insurance. That's why we are trying to create a kind of a value-added services, so people will believe in insurance. And health insurance is actually very much aligned with the health sector. So and technology definitely is a part where it is very much needed. So I think I do believe, and we have experienced a lot through our Nivedita app, where I'll be talking more in that area, where we are partnering through our subsidiaries and also through our network partners. And there are a lot of startup techs which brings in more addition, more value-added services. And I think Dr. Abhijit also mentioned where, you've seen the Pulse Healthcare that is being launched recently. So these are the service startup techs which can provide services through our service platform, where we can align the insurance as well. So maternity, healthcare, then, child mortality rate. I think this will probably go down.
There are so many sectors where we can implement these things properly,
Yes.
and also from the private and public sector must work together. Otherwise,
Absolutely.
it's not
See,
going
we
to
are.
be
This is like our
successful.
partnership.
Yes.
So, like when we work with partners like Pava and other healthcare services, they provide the medical reports. The medical reports has to be accurate. So in that case, all the partners have individual responsibility in terms of providing the services to our customers. The more accuracy will be there, the more confidence and trust will follow
Of
through.
course, everywhere we have the question of trust.
Absolutely.
আমরা অনেক সময় দেখি এক একটা জায়গায় একই পরীক্ষার এক এক রকম
এটা
report
আসলে
দেওয়া
এটা
হয়।
একটা খুব বড় ধরনের, আমার মনে হয় এটা একটা হ্যাসেল বাংলাদেশে, যে আমরা এক এক জায়গাতে হয়তো কেউ বলে আইসিডি ইজ দ্য বেস্ট, বিদেশে হয়তো যেমন থাইরোকেয়ার এসছে, আরও অনেক, প্রাভা, অফকোর্স আই মেনশন ইউর নেম ফার্স্ট। সো দের আর সার্ভিস প্রোভাইডার্স। আমার মনে হয় একটা জায়গাতে এসে একটা এনলিস্টেড থাকতে পারে যে কাদের রিপোর্টসটা মোর অ্যাকুরেট। সো এই অ্যাকুরেসি আনতে গেলে ইউ নিড টু, এভরি সার্ভিস প্রোভাইডার হ্যাজ অ্যান individual responsibility in terms of providing services. So আমার মনে হয় শুধু একজন হিসেবে আমরা কাজ করতে পারি না। We have Telenor, Telenor আজকে অনেক বড় ওয়েতে, বড় আকারে কাজ করছে, আমরাও তাদের সাথে কাজ করছি। অ্যান্ড আমার মনে হয় এখানে ইন্ডিভিজুয়াল এবং টেলকোর মাধ্যমে কিন্তু you can reach out to people of Bangladesh. It's very easily. So telco also, plays a lot of important role in terms of communication. So what we communicate to our clients, that is very important.
I will be back to you again, madam. So I would like to ask Professor Abhijit. You have a vast experience from the health insurance and also from the technology. How would you like to incorporate these things? I mean, the health technology with health insurance, how important it is?
Absolutely important in the sense that technology and health insurance must go together. In India, what happens, it will travel in India, I don't know, we provide cashless services. So when a patient goes to a hospital, the hospital goes to gives an estimate of expenditure. And now this estimate of expenditures are weighted. There is another body called what we call TPS, Third Party Administration. There was a time when the estimate of expenditure used to be sent manually, used to take 3 days to reach, 3 days to come. So one particular health interventions, the treatment for that health intervention used to take 7 days time. Today what is happening? Because of technology, everything is digitized. The moment it is digitized, it is immediately sent to a panel of doctors at the TPS office, and you get pre-authorization very quickly. So a thing which used to take 7 to 8 days time to, now it's taking only about 2 hours time. So that way technology has played a very big role. What is really cashless experience? Look what happens in any form of insurance, particularly in health insurance. What do you say? We don't have a product. We don't have a concrete product. It's an abstract product. So what we sell is experiences. When Moin Bhai was saying that he's sending patient from Bangladesh to India, Bangladesh, Malaysia or Singapore or the other country. Now, a patient goes to India, reaches a hospital, and the experience in the hospital is bad, then who is going to suffer? The company is going to suffer. And that's where the entire ecosystem needs to understand that today a hospital or the whole medical fraternity will not exist if they do not create an experience which is admired by the customers. Customers must admire that experience. If the experience is good, then insurance, when you are talking about trust, why we are not trusted? This simply because of the reason when we have to pay claims, we torture people to such an extent that next time he doesn't come back to us. And when I joined industry in '86, today when I reflect and I find we were diabolic. A simple scooter claim for 3,000 rupees, we used to take 3 months time to settle a claim. I used to settle manually health claims, and one health claim would take 6 months time. Now from that, today we have traveled a long way. The problem and the challenge is technology has come in a big way. Technology is partnering with the industry. Like in Bangladesh, when I was going through the literature and I found plenty of insurtech, health tech companies are there. And how well a company like Green Delta works in a very integrated manner. It has to be a very integrated platform where all these startup companies come. So some companies is very good in negotiating with the doctor. If you have the experience of US market, then you will realize in US market, they call managed care. So when you go for a health insurance, they say, okay, we don't only sell health insurance, we will entirely manage your health. How I manage, that's my job. So right from appointment to going to a right kind of hospitals, today, an insurance companies must know the clinical guidelines very well. If I am in health insurance, if I am not aware of clinical guidelines, then doctors like madam will take me for a ride. And they will negotiate any ride. Look, this is what I am giving. If I know, look, this is the clinical guideline. You must start from here. If you fail here, then you go to the next step. And there the technology has a big role. Today we work with ICD, the International Classification of Disease. 11 we are working with it. What I teach my students, look, you have to know what particular disease requires what kind of intervention. When you go to the industry, you should be helping. Look, if a doctor makes a mistake, if he wavers from a clinical guideline, it is there I will point out. Bupa experience, what was Bupa experience? Long back, an operation, a surgery used to take place, and doctors sitting in America would monitor. He would say, a Chinese doctor, look, you are going wrong. What happened? Chinese doctor said, look, you don't have business to do. You cannot do business with me. Bupa could not enter the Chinese market. They are in Indian market. I don't know whether they are in Bangladesh. That's the kind of interventions they do with technology. Sitting there 5,000 kilometers away, and they monitor a surgery, say in India or in Bangladesh. That's the level of clinical effectiveness they are giving. What technology should be doing? these facilities are fine, but in health insurance, it is the clinical appropriateness which is very important. If you are clinically not appropriate, then you are not doing a right kind of service. And there, the technology has a big role. How you can ensure clinically appropriate medical intervention.
Thank you so much. I would like to go to Mr. Sajid Rahman. As Professor Avijit was talking that it is a product actually, but it's an abstract product, the health insurance thing. And before we go for health insurance, we have to know about our health. What actually I do and what kind of risk I am facing in my career or in my daily life. So how do you evaluate this health technology in relating with health insurance as a product? Maybe it's an abstract product. And how would you, how important you find that to fund this type of health insurance and health technology in our country?
Thank you. Before we go into the health tech and investment funding, so globally, in general, the health tech funding has been very low. If you look at all the other metrics, let's say ride sharing, social media, e-commerce, or compared to any other industry, health industry has traditionally been lowly funded for two reasons. First is, aage jara investor chilo, they thought it's very difficult to crack. To be really successful in health company is very difficult. Second, the industry itself has been governed by too many regulations. So very bureaucratic, very difficult to actually crack. And I've seen investors, very renowned investors, the moment, on the investment thesis, they have been very clear that we don't fund tech health companies because they thought it's very difficult, right? But we are now in a very interesting situation. The decade that we are now in, which just started, I think this will be the decade for health tech companies because two things. Globally, if you look at all health companies, right? What is our ultimate goal? Our ultimate goal is that no one falls sick. Our ambitious goal is no one ages. Right? So that's the holy grail of health companies. Now, what's happening is, আমাদের এখন একটা তো হচ্ছে যে প্রচুর মানে computational power বেড়ে গেছে. I'm sure most of you know that. Second, we are having this situation where we can now sequence DNA at a very cheaper rate, right? So we now have a situation where we have a lot of DNA data. I don't know whether you're following this, but the coronavirus, আগে যে SARS বা Ebola যেগুলো হয়েছিল, now from the date was detected, within 15 days you have the DNA sequence done of the virus, right? So it is moving at extraordinary pace. So now with their DNA analysis and that sort of computational biology, the whole idea is that can we make our body better? আগে একজন ডাক্তারের কাছে গেলে আপনি অসুখ নিয়ে গেলে ডাক্তার আপনাকে ঠিক করে পাঠিয়ে দিত. That was it. So bring you back to your original shape, right? এখন the challenge is the doctors are becoming more like engineers. The question is that can we make this body better so that it doesn't age, right? So we are now pushing those boundaries. In context, I think health tech is now poised for huge investments. If you read or if you followed Apple's last annual report, Tim Cook is now positioning Apple not as a mobile phone company but as a health company. Okay. Amazon has taken a big bet on health. Microsoft is thinking health tech is going to be the big one. So there's a huge focus because they think this is the next wave that's coming in. So funding will come in a big scale. Bangladesh's context, so if you look at the whole health landscape and where we can invest, all these cutting edge technologies, ages, like we're talking about computational biology and stuff like that. The other is a very pure public health play, which is essentially giving people access to healthcare. So jar একটা ডাক্তার সাথে অ্যাক্সেস থাকে না বা যার একটা আপনার ধরেন একটা ভালো মেডিসিন পায় না বা যার হয়তো হঠাৎ করে একটা ইম্পর্টেন্ট ইনফরমেশন দরকার, রাইট? সো দিস আর পাবলিক হেলথ. সো হেলথকেয়ারের আরেকটা কমন প্রবলেম আমাদের মতো দেশে যেটা হি ওয়াজ শোয়িং কনজাম্পশন অফ হেলথ প্রোডাক্টস, রাইট, উইচ ইজ ভেরি লো. আমাদের অনেকেই কিন্তু ধরেন একটা এমআরআই টেকনোলজি, রাইট? সো উই অনলি ডু এমআরআই ইন এ ভেরি এক্সট্রিম কেসেস একটা হসপিটালে গেলে. But that technology can be significantly improved with latest technologies যেখানে অনেক সময় গ্রামে গঞ্জে বসে এমআরআই করা যেতে পারে, right? So the question is that do you wait till একদম শেষ পর্যন্ত গিয়ে then MRI, or do you do MRI at a very early stage where it can be detected and solved, right? So the question is that how can we increase the consumption of these health services in a significant way? That's where health technology comes in. এবং আমার মনে হয় বাংলাদেশের মতো দেশে এইখানে there is a big role to play. How we make healthcare accessible, quality healthcare accessible by using technology, democratize the process. So সেখানে there is a lot of opportunities.
I have a personal opinion here. Sometimes we see their facilities near to the community. গ্রামের মানুষের কথাই যদি বলি খুব কাছেই হয়তো সেই ফ্যাসিলিটিসটা আছে যেখানে গিয়ে হয়তো উনি একটা এক্সরে করে ফেলতে পারবেন যেটা খুব অ্যাডভান্স বাট হি ডাজন্ট নো ডু নট নো দ্যাট দে হ্যাভ দ্য ফ্যাসিলিটি দে রান ফর দ্য সদর হসপিটাল অর ফর ঢাকা and even for the Dhaka people they run abroad. So is there any scope for health education also to make them literate about these things যে তারা জানে আমার কাছে এই জিনিসটা আছে আমার এটা করা উচিত অ্যাওয়ারনেসটা বাড়ানো because I have an experience where we introduced the health insurance things for a definite government workers. There were 7,000 of government workers then. There were so many organizations involved within and we provided the health insurance with some educational thing also. But we could not make that whole research thing possible because of time. কারণ গার্মেন্টসে যারা ছিলেন তাদের কাছে মনে হচ্ছিল যে আমরা যে বারবার যে ডেটাটা নেই তাদের লস হয়ে যায় সেই জন্য এটা কমপ্লিট করতে পারিনি এবং দেখা গিয়েছিল যে যেই জিনিসগুলোতে আমরা ইন্স্যুরেন্স দিচ্ছি বা হেলথ কেয়ার প্রোভাইড করা হচ্ছে তারা প্রয়োজনের আগেই সেটা খরচ করে ফেলেন তো সেইখানে কি আমাদের হেলথ টেকনোলজির পাশাপাশি এডুকেশনেরও কোনো বিষয় ঢোকানোর কোনো স্কোপ থাকছে
Obviously, মানে education awareness is a big thing. Health business, one of the reasons it's very difficult to build a large scale health business is হয় কি আমরা তো we don't get sick every day. হ্যাঁ কিন্তু আমরা কিন্তু হয়তো এখানে বসে থাকতে we probably check messages 20-30 times. অথবা we go to social media I don't know how many times. So health কোম্পানিগুলোর সাথে our interaction is very infrequent. So it's not at the top of the mind. So that is one of the reasons health insurance is very difficult to crack because you don't need it. আর গ্রামে বা গঞ্জে যার ধরেন ডেইলি ইনকাম ধরেন 50 টাকা or 100 টাকা রাইট তার জন্য ওই একটা অ্যামাউন্ট করে রাখা এবং উই টেস্টেড ইট ইন মেনি মানে গ্রামে গঞ্জে উই টেস্টেড উইথ আওয়ার প্রোডাক্টস তার জন্য প্রতি মাসে 10 to spend 10 টাকা অন আ হেলথ ইন্স্যুরেন্স এবং যেটা উইদিন হি প্রবলি ডিডন্ট ইভেন টাচ ফর আ ইয়ার দেন হি উইল জাস্ট স্কিপ ইট So I think somehow to engage them is very important.
I just want to add to what Sajid Bhai said. আমাদের যেই হেলথ মিনিস্ট্রির সাথে যেই স্বাস্থ্য সুরক্ষা কর্মসূচি প্রোগ্রামে আমরা স্কিম অপারেটর হিসেবে কাজ করছি যেটা ইউনিভার্সাল হেলথ কেয়ার সো এখানে তিনটা ঘাটাইল এবং মধুপুর এবং কালীহাটি এই তিনটা জায়গায় প্রায় 6.5 লাখ অধিবাসীদের বায়োমেট্রিক তাদের হেলথ মানে বায়োমেট্রিক কার্ডের মাধ্যমে হেলথ ইনফরমেশন কিন্তু নেওয়া হচ্ছে এবং সেখানে শুধুমাত্র তাদেরকে এই ফ্রি হেলথ ইন্স্যুরেন্স আসলে সার্ভিসে দেওয়া হচ্ছে না যে এডুকেশনটা ইজ ওয়ান অফ দ্য মেজর এরিয়া বিকজ যে দেশে ইন্স্যুরেন্স সম্পর্কে বা হেলথ কেয়ার সম্পর্কে কোনো অ্যাওয়ারনেসই নাই সেখানে আমার মনে হয় কোনো একটা প্রোডাক্ট যখন দিতে চান যেমন এই যে একটু আগে দাদা বললেন যে একটা ক্লেম দিতে 3 মাস লেগে যাচ্ছে তো এটাতে আবার ট্রাস্টটা আবার চলে যায় সো সেখানে কিন্তু এই পুরো প্রোগ্রামে তাদের যে হেলথ অ্যাওয়ারনেসটা করানো হচ্ছে এবং তাদেরকে যে গভর্নমেন্ট ফ্রি সার্ভিস দিচ্ছে 50,000 টাকার একটা কাভারেজ এবং সেখানে যে কিছু প্রি এক্সিস্টিং ডিজিজ আছে এগুলো তাদেরকে বলে দেওয়া হচ্ছে এবং উঠান বৈঠক একটা হচ্ছে ওদের এই বিভিন্ন আমাদের হেলথ কেয়ার কর্মী বাহিনী আমাদের আছে এবং গভর্নমেন্টে যারা আছেন তারা মিলে আমরা এখানে একটা প্রতি মাসেই একটা করে একটা সেশন হয় এবং সেখানে এই ধরনের অ্যাওয়ারনেসটা করানো হচ্ছে
সেটাই আমাদের আসলে ঘুরে ফিরে পার্টনারশিপ বা কোঅর্ডিনেশন
পার্টনারশিপে আসলে লার্নিংসটা আমাদের দুজনেরই আমাদের এডুকেশনটা শুধু যে রেসিপিয়েন্ট তাদের জন্য প্রযোজ্য না আমরা যারা কাজ করছি তাদের জন্য কিন্তু এডুকেশনটা সবচেয়ে বেশি দরকার হ্যাসেল ফ্রি এবং যেখানে অ্যাকিউরেট এবং ট্রান্সপারেন্সি অফ দ্য সার্ভিস ইজ ভেরি ইম্পর্ট্যান্ট যে এই জন্য মানে শুধু আমাদের তাদের যে চাহিদাটা সেটা দেখে আমরা কিভাবে আগাবো যেমন আমাদের সাজিদ ভাই বলেন যে আমাদের এখন বয়স তো বাড়ছে এমনও হচ্ছে যে যেমন হেলথ ইন্স্যুরেন্স কিন্তু বৃদ্ধ বয়সে 65 বছরের উপর ঊর্ধ্বে গেলে there is an additional premium because যাই আপনি করেন সেখানে অনেক প্রি এক্সিস্টিং ডিজিজ থাকে প্রি এক্সিস্টিং ডিজিজ হয়তো নর্মাল কাভারেজে থাকে না বাট there are options where you can pay more premium so এটাও আবার কিন্তু একটা এডুকেশনের ব্যাপার আছে কেন আমি বেশি প্রিমিয়াম দিব বিকজ অফ দি মানে এরকম মানে হয় না যে অন্যরকম কোনো বিকজ একজন বুড়ো মানুষের রিস্ক বেশি থাকে একটা হার্ট অ্যাটাক হতে পারে সো ওই সময় কিন্তু যেই প্রিমিয়ামটা নিচ্ছেন তার এগেনস্টে অবশ্যই তারপর যদি
তাকে
সার্ভিসটা
জানাতে
দেওয়া না
হবে।
দেওয়া হয় সেটাও একটা ব্যাপার আছে।
আমরা এবার একটু সিলভানা কাদের সিনহার কাছে আসতে যাচ্ছি। You started the Prava Healthcare. We want to know from you what was the experience and what pushed you actually to start this Prava things, and then we would like to share your experience or what you think that how we should guide our policymakers to follow this type of thing or to improve our health system in Bangladesh. What was your experience and what geared you to start the Prava?
Sure. So I had not worked in healthcare before I started this business, actually. So I came at it from the perspective of a patient and the family member of a patient. I actually never lived in Bangladesh before I started the business. Also, my family is from here, but I was born and raised in the U.S. And so I had been visiting for a family wedding, and my mom ended up hospitalized for a basic appendectomy. And it was my first up-close experience of the limitations of the system. It was very eye-opening. The surgery was, and we were in the VIP suite of one of the fanciest private hospitals in this country. The surgery was delayed by 10 hours and causing the appendix to rupture, and then she had a lot of complications afterwards. And I was very struck by the doctor's dismissive attitude, and we ended up airlifting her to Bangkok, where she had to have another surgery, and then a year later, another surgery. And I had heard from other family members, as Farzana Appa mentioned, there are mistakes in diagnostics happening all the time. Many people are, sending the same sample to 5 different places and literally getting 5 different results. And I had family members who had suffered either they had been told they had cancer when they did not, or their cancer was overlooked here in Bangladesh. And so I knew these problems existed anecdotally, but I had no idea what the solution should be. And I think we're all still trying to figure that out, but I had no idea what I could do. And so I spent about a year on a listening tour. I spent a lot of time here in Bangladesh talking to patients, learning from what the experience was here, what patients really felt they needed and were missing from their healthcare system. And I was in particular really interested in the middle class segment of the population, which is, arguably 40 million people now. And the rich are traveling for healthcare, and the masses, due to tremendous investments in primary care, are actually doing much better than they were a generation ago. You have, under 5 mortality has reduced by, I think, 60%. And other forms of mortality, neonatal, child, nutritional disorders, mortality is more than 70%. And so the public system has done a pretty good job. But the interesting thing is the middle class does not want to access the public system and can't really afford to make a foreign trip, but they're still doing it. Every day, the Indian embassy in Dhaka is issuing up to 2,000 medical visas. And we have more than $2 billion a year going outside of the country for healthcare. So I actually went to the Indian embassy. There's a separate line. I don't know how many people have been there. There's a separate line for medical visas. And actually asked those people, why are you leaving your country? What is it about your healthcare system that's failing you? And across the board, none of them talked about diagnostic error rates, which I originally hypothesized was the problem. They all said this issue of trust that's come up already a few times. They just don't trust the system. They don't feel the doctors in Bangladesh spend any time with them. They don't answer their questions. They don't even look at them in the eye. And so that was really eye-opening to me. And, I had thought, maybe I can just build a lab. Maybe I can start, maybe I can build an app. But I felt at that time, and I still feel, that to truly create systemic change, we have to restore trust in the system through infrastructure. And technology is an important enabler to that. And I think that Professor Abhijit's point on, clinical decision-making tools that will help to improve diagnosis, using technology to improve efficiency, operational efficiency, and using technology to improve access, as Pulse is doing. Those are really important things, but at the end of the day, I think we have to strengthen our infrastructure. And so that's what we're doing, basically. We're building a healthcare system grounded in family health, in-house, basically integrated outpatient healthcare. So centered around family health, whereas you have a public system that really invests heavily in primary care. Unfortunately, on the private side of the system, it's very fragmented and transactional and very little value placed on primary care. So we're trying to mainstream that concept with our family doctors, So we have a team of professionals, family doctors, women's health, pediatrics, dentistry, ophthalmology, and specialists in cardiology, gastroenterology, and other areas. And we do all of the diagnostics in-house. So we've set up what we believe will be the next internationally accredited lab in the country. We also do the full range of imaging services in-house, and we also have in-house pharmacies. And we source directly from manufacturers because
I will just interrupt that. My friend is also taking the facilities from your services. What kind of patients or what kind of family are actually coming to Prava? Are they from middle class or from the upper class?
So it's a range. Our target group is the middle class.
Yes.
And so to be honest, we do see the elites because it is a world-class healthcare solution that we're trying to offer in any case in this country. But we're also even seeing people from the masses. I see more and more people who aren't wearing shoes, and I love to see that actually. So the price point is very accessible. Certainly, basically we say we kind of price ourselves in between the overstretched public facilities and the overpriced private facilities.
Yes.
So we're kind of in the middle of that.
Thank you. I will come back to you again because I had an experience from other organization who used to charge less in the rural area for the same diagnosis, but they used to charge in the upper class, like our posh areas, what we call Gulshan and Bonari, just to make the balance. So that was another type of practice which I appreciated. That's it. I want to come to Rubaba Appa now. All of us know that you as one of the most successful women in the marketing arena in Bangladesh. So you have also experienced from other countries also how to market and how to visualize your products to the people. So how do you think, what made you to start these pulse services? Maybe from some seeing the lackings in Bangladesh also. And how was the first experience? কেমন ছিল শুরুতে কি খুব সহজ ছিল বা কিভাবে আপনি জিনিসটা শুরু করার পরে ধাপে ধাপে এগোলেন এবং আমাদের দেশের এক্সপেরিয়েন্সটা কেমন ছিল?
Thank you for the question, and thank you for having me here. Just to start with, I think probably my career started with telecommunication. So I worked with two of the largest telecom operators in Bangladesh for almost 19 years. And since inception, what I've seen is how we have been able to empower people through telecommunication. And when we included internet into it, apart from just making voice calls and connecting people or connecting rural area with urban area, we have seen how we were able to add value to general people's lifestyle, right? So we have seen how technology has empowered women. We have seen how technology has connected businesses with their customers. We have seen rural people, for example, farmers, when they were selling their products, they were dependent on the middlemen, right? So they started to eradicate the middlemen and started taking the actual market price utilizing telecommunication. And over the years, what we have seen now, as of now, out of 160 million people, 158 million people have access to mobile phone. 90 million people have access to internet, and majority of these people are accessing internet through mobile phones, right? So since I've had this experience and I've seen how we have transformed lives and businesses, when I left the telecommunication field, I was thinking, how can I create some kind of impact which will actually have some positive effect for the general mass? And I was looking at various ICT-based sectors. I looked at education, I looked at e-commerce, I looked at agriculture and all that. And when I started to see the facts and figures with regard to healthcare, that really made me think through. And then I decided that there are only very few such health tech companies in Bangladesh which are catering to this particular problem that we are facing. There are only 68,000 doctors for 160 million people. So the doctor-to-patient ratio is 1:3,000. According to who, they say that it should be minimum 1:1,500, and the best is 1:3 or 5, right? So look at the difference that we have, the gap that we have. Now, if you take that ratio with specialists versus patients, then that's even much larger. If you take that gap with mental health practitioners and patients, that's even more, right? So what we have understood is that especially people who are in the rural area, which is 70% of our population, they don't have access to quality healthcare. Now technology is an enabler and mobile phone is in the hands of people. How can we connect this health tech and mobile phone and take it to the last mile? So that was the main idea behind it, and that's how we have founded the Pulse Healthcare Service, which is a cloud-based telemedicine platform that enables healthcare providers to connect with their patients remotely through an encrypted video conferencing platform. And with that, remotely from anywhere, anytime within Bangladesh, you can consult with a general physician or specialist. So that's the main vision behind it. It's a very basic problem that we're trying to solve, because now when you think of health tech, you think of genomics, you think of biotech, you think of robotics, you think of AI, machine learning, IoTs and all that, right? But the basic accessibility, affordability, reaching out to quality healthcare is missing in a place like Bangladesh, where we have 160 million people, 70% living in the rural areas. So why not make use of technology and connect them? Having said that, you asked me what's happening globally. Let's not look into the developed nation, because they have gone really advanced when it comes to biotech and health tech. But look at our neighboring country, India. I was just looking at some of the figures. There are about 3,000 health tech startups in India. They have raised almost probably, I don't know, $500 million worth of investment for those health tech. And they're projecting that by 2022, it'll be almost worth about $370 billion worth of industry with about 30 to 40% return. So that's a huge market we are talking about. Why not the same in Bangladesh, where we have such dearth of solution for mitigating these kind of problems that we are facing, right? So I think there is huge potential in Bangladesh. We don't have to go to biotech and all that, but let's give access to quality healthcare through these kind of diagnostic centers by providing, microinsurance, health insurance, and connecting and integrating services. So if you can connect the entire healthcare ecosystem and bring it under the digital connectivity, then you'll be able to connect the entire pool of services that we are providing. So we are trying to provide through Pulse a one-stop service. So first is doctor-to-patient connectivity. Second would be online pharmacy. Then we're also trying to connect with the other providers who are the experts in this, because I don't want to start from scratch where they've already built the basic structure and infrastructure for that. So we would like to connect with these partners, third parties, through whom we can provide this kind of quality healthcare to the people of Bangladesh. So that's the main idea and vision behind it.
What our experience says that most of the people who get sick wants to visit the topmost doctor.
Yes.
Because we don't have any referral system type of things in Bangladesh, but like I have to go to the junior doctor first, then he or she will refer.
Yeah.
So in this type of service, as you are doing, the Pulse service, what is the response from the public? What they do when you connect them with the general?
So, my main goal was to connect the rural patients with doctors or specialists in the urban areas, mainly in Dhaka and other towns across various divisions. But what I'm also seeing is that many people in the urban areas, because of convenience, they want to connect to doctors online as well, because we don't have the time to commute and, wait 2 hours in traffic and then wait at the hospital for 1 hour and all that and get 2 minutes of time from the doctor, right? So we do see that people are making use of technology just for the sake of convenience, A. B is, if I ask everybody here, if you go to a doctor and doctor tells you come after 7 days, and if you feel that I feel okay in 3 days, do you go back?
No.
You seldom do that, right? And then if you're asked to go and get the report from the doctor's place after 7 days, you would probably wait until you're free and all that and then go and collect it, come back, go back again. So 3 times you're having to commute, wait, and get your report. When you have this kind of digital platform, it's instant. So these, diagnostic centers or clinics or hospitals, they can send you a report online. So we have EMR feature embedded into our platform as well. So you can you can store your medical records, and you can also share your medical files with the doctors and receive e-prescription. So to answer your question, people are looking for specialists. However, I've also found many people who just don't know where to go, which doctor to go to. So they need a bit
Even
of
today I answered the same
counseling
question.
as
I
well.
have this type
So
of
I have
question.
GPs, I have the Pulse doctor as well, who's providing this kind of consultation, suggestion, and advice that you should go to a neurosurgeon or you should go to a pediatrician, and this is how we are trying to connect them with the right kind of doctor. And I think the idea of having a family doctor or a GP is not yet established in Bangladesh, which probably Prava is working on, right? But we don't see that people are seeking that. They actually want to connect to a doctor in Dhaka, the ones who are
Yes.
situated in the remote areas. Yeah.
I mean, I think that is one of the challenges for the system, actually, is that the specialists are overburdened. And in many cases, they're acting as, internal medicine specialists or regular practitioners. So this is one of the challenges I think we face for the system, is that it's very inefficient because people, I have seen people I know in my family, they're feeling a little short of breath, they want to go to the lung specialist. But it might be a heart issue, right? And so the family doctor's job is actually to help to assess, and in most cases the family doctor can actually help. But that existed, I think, a generation before in Bangladesh, that's my understanding. But there has been kind of a shift, and people feel they want to go directly to a specialist. So it requires awareness, I think, to change that.
I think it goes like a cycle, because I am told that my grandfather and grandmother had their family physician. But nowadays we are again trying to introduce this thing again in our country. Thank you, all of you. Now I would like to hear from all of you, actually, what are the problems you are feeling inside, like doing the health technology, introducing in our health system, or how to improvise our health system in general, and what's the importance of this partnership actually? Because what I have some experience, I am working both in for the government organization and non-government also. Mostly what we think, health technology is M-health, using the mobile phone. And there are some IVR type of technology, recorded voice, asking you some questions, and sometimes the patient get bored. So if yes, press 1, if no, press 3, and you have to go for 34 and 40 questions, what I'm doing right now. So they get bored. So it's, I think it should be much more interactive, or much more enjoyable things should be, if we want to do that type of research. So from your aspects, what are the problems actually you are feeling, and what would be the solution to improve our health system? I want to start with ma'am again.
Thank you. I think I would just mention it's all awareness and educating ourselves, because this is something, a new area. Because as you know that the healthcare, total healthcare expenditure, the 67% of the healthcare expenses go out of the pocket expenses. So that is one major issue in Bangladesh. People, when they want to spend money in healthcare, their expectation is actually at the highest level. So that's why when you see that, if I call a call center and there's a chatbot asking me all these questions, I would not, I said no, I'm not getting the right answer at the right moment. So we need to kind of, as everyone has mentioned, and we need to point out each of the stakeholder has to come forward. It's a multi-stakeholder approach. How can we reduce the cost in the process? How can we reduce the time consumed? How can we reduce, the bad experience? That is something that we need to kind of engage ourselves. Unless we engage ourselves, we will not, if we don't get the experience, we will not say, because resistance is one area that I feel that Bangladesh, technology, আমরা সবাই বলছি, technology নিয়ে কথা বলছি, like you'll be surprised to know that you talked about farmers, right? Other speakers also mentioned farmers. There was a time where livestock insurance was a kind of something that no one even thought about it, because it was a failure. But technology has actually broken the barrier, right? What happened is, with the NFC tagging system, controlled by a smartphone, a farmer can get a loan from a bank. So in that phone, you can receive all the information regarding the health situation of that livestock. So it is actually kind of transforming that cow into an asset. So now banks are coming forward to give loans to the farmers. So this is kind of, the kind of, that was thought of, like impossible. Now people are thinking about it. So health technology is something that we need to, all the partners, we need to be in one platform. So how we can reduce all this cost? Why, how come these chatbot questions can be reduced to from 40 questions to 5 questions, 5 simple questions? These are the areas that we have to look into it. And I guess this is one area. And then another area is every day technology is changing. One thing that you come up with, an app or something, it becomes obsolete the next day. So what do we do? So it's another, area that we need to kind of see what's the latest technology. Like you said, like, of course, developed countries have gone so far. I mean, we have to see what's happening. In our neighboring countries. We don't have any health record, do we? We do not. If we did, then we could have sold health insurance just like policybazaar.com. So you'll be happy to know that we are into a process that we'll be actually giving a calculator in an aggregator. So the insurance industry. So that in that you can calculate how much premium that you have to pay. So we're in the process of that. So I think technology platform has to be updated, has to be it has to be a solution that is required by the recipient. So we have to give the patient the appropriate treatment at the appropriate place, at the appropriate time, and the outcome should be, great. So hospitals sometimes they give you a lot of pills. So we do not have any third-party administrator. I'm sure that you have heard that GD Assist is acting as a third-party administrator for our health insurance, because in individual health you need to give, information in few hours time. They do not wait for 7 days or 3 days or 2 or even 2 weeks. So we are now trying to give it in 3 hours or in hours. Sometimes it will be minutes. So you need to see which are the simple questions that can be dealt by an chatbot or an artificial intelligence. You need to have human touch. You cannot give everything to the technology platform, right? You need to have the human touch, like the physicians. We always go to all those 10 top physicians. There has to be a platform where you can get all the information of all the other doctors and what are their specializations, and their stories has to be told. So these has to be linked, and our medical records has to be with us, because if you go to other countries, you'll see in Malaysia they have a very small pen drive. That actually, that pen drive, if you bring that and you log into the system, the whole your medical record comes into that platform, and all the doctors can have an access. So access to healthcare is the major issue, and technology definitely can act as a enabler, but it's very important what are the other stakeholders are doing from their own
sharing the information and knowledge is very important.
Absolutely.
It's not to be kept in the treasure box.
Not really, because believe me, in Bangladesh we do have good doctors, and probably we don't know about them. I mean, there will be a good heart specialist, maybe in Chittagong or even Parvotto Chattogram, but no one knows about it. So there has to be technology somewhere, has to act in that way, that connecting people, connecting information, its data bank has to be so rich so that you have all the information. Easily accessible.
Medical recorder, Bala, you should. বিফোর উই মুভ অন টু আমি বাংলা একটা গল্প শেয়ার করি আমাদের মেডিকেল রেকর্ডের বেলায় আমি একটা হসপিটালে কাজ করেছি কিছুদিন সেখানে বলা হতো যিনি আসবেন তাকে একটা ডিজিটাল নাম্বার দিয়ে দেওয়া হবে আইডেন্টিফিকেশন নাম্বার এবং ওনার মেডিকেল রেকর্ড সব আমাদের কাছে থাকবে আর্কাইভে থাকবে তা আমি একটা পর্যায়ে যে আমি যেহেতু একটু রিসার্চে ইন্টারেস্টেড আমি ওটা চেক করতে শুরু করি এবং এমন একজনের নাম যেটা আমরা সবাই জানি সুরঞ্জিত সেনগুপ্ত যিনি চলে গেছেন আমাদের ছেড়ে তার নাম 17বার এন্ট্রি ছিল এবং ওনার 17টা মেডিকেল রেকর্ড ছিল তো এইটা যদি আমাদের মেডিকেল রেকর্ডের অবস্থা হয় যে যিনি যতবার ভর্তি হচ্ছেন ততবার ওনার নতুন করে মেডিকেল রেকর্ড রাখা হচ্ছে তাহলে সেটা কিন্তু আসলে আমাদের কোনো কাজে এলো না সেটা শুধুমাত্রই রাখা হলো সো মেডিকেল রেকর্ডের অবস্থাটা যেন সেরকম না হয় প্রতিবারই ওনাকে দিয়ে ফর্ম ফিল আপ করানো হচ্ছে প্রতিবারই ডিজিটালি ওটাকে এন্ট্রি দেওয়া হচ্ছে কিন্তু অ্যাট লাস্ট আমরা ওনার টোটাল কোনো কমপ্লিট রেকর্ড পাইনি আর্কাইভ আর হচ্ছে না ওটা শুধু ডকুমেন্ট আমরা যেরকম কাগজ রেখে দিই একটার উপর একটাই সেরকম ছিল ইয়েস
No, I completely agree on the medical records point. The government has stated an intent to roll out BANMI, which is an open source platform, hospital information system. But I don't think many steps have been taken. We really do wish the government would take more of a lead, I think, in rolling this out. I mean, Prava has introduced, we have the first fully integrated hospital information system in the country that features an EMR and a patient app. But the interesting thing we find, so the patient app allows you to book appointments, book health checks, you can view all of the doctors, all of your medical records are there also. So in most places you go and get your blood work done, you go home, and then you have to go back and pick up the record. That's not the case at Brava. But despite that, it's hard to change consumer behavior. Many patients still want to come and pick up the report. They have this. So I think it's incumbent on us as entrepreneurs to create solutions that are, in order for anyone to change their behavior, the option, like when did we start using these for phones, for cameras, right? I remember when it first came out, I thought it was a stupid idea. But it has to be 10 times better than what existed before. And it's more than 10 times better than what existed before, and that's what caused me to change my behavior. So we have to also keep innovating, I think, and creating better solutions. So we're rolling out a new version of our patient portal at the end of this year based on what we've learned from our patients so far. Because we still find that even though they have the optionality to do a lot of things, they're not necessarily using them right now. I think that was all I wanted to say, but I really hope that this group can maybe come together and maybe form some sort of a working group, because I think we have an opportunity to make proposals to the government on where we can take things. Because if they don't have the capacity or the imagination, maybe we can be part of that.
Definitely, we will try to do that definitely. To Rubaba, ma'am, please.
I think your question was with regard to the challenges and problems we are facing. Right. So what challenges we are facing in healthcare, we all know that, right? Even though it's the fastest growing sector in Bangladesh, but when it comes to health tech, I don't know if we can call it an industry yet, because we need more startups, more health tech based companies coming up. But many companies are going through digital transformation, and so is the hospitals and clinic and all that, right? But the most important aspect now is data protection, is data security and safety. So how can you have trust in this technology if you're not sure about data safety and security? I think that's the biggest challenge that we will face going forward when more and more digitization would happen, when more and more we will introduce EMR and file sharing and data transmission related services, right? Of course, that is the main asset for this particular industry, because through that you'll be able to detect diseases, you'll be able to provide more preventable solutions, proactive services. But having said that, that's one of the key areas that we have to focus. And I also feel, which you also mentioned, I think it's important for us to have some established standards and protocols and legislations around the health tech services or products that we're bringing into market. Because if you don't have standard forms or standardization within this particular health tech ecosystem, then it'll be a disaster, because you won't be able to integrate afterwards. So we have to create that. For example, many of us are creating e-prescription, but there's no standardized e-prescription form, right? So we have to probably work together to propose these kind of things to the maybe health ministry, because they're the ones who are trying to make some policy reforms, and if we go to them, I'm sure we will get some good result. Of course, we want them to be facilitator rather than controllers and regulators, right? So we would like to take this, because this is only going to help the citizen. because non-communicable diseases account for 67% of the death in Bangladesh, where only 1% of the government and donors fund is contributed to. So we really have to focus on that, because through these kind of services we should be able to provide access to digital healthcare.
Thank you. To Mr. Sajid Rahman, please.
Thanks. Before talking the problem, let me talk about what the solution will look like. Right? So the solution will look like this. So think of a woman at a very remote part of this country, and she's wearing a bracelet, which collects all the important information, right? Her heart, her blood pressure, everything. And at one point, the bracelet bips and tells her to talk to a doctor, who she calls. The doctor takes the information, creates a medical record. Doctor feels like she needs to go to a hospital, so refers her to the nearest hospital, and the medical record gets transferred. It's an interoperable system. And the doctor, from a primary care doctor, thinks it's more difficult, so sends her to a tertiary care. The tertiary care doctor actually thinks it's a serious issue, so did an operation, send her back, and as she went home, she again gets a post-operative, tracking. So she gets tracked for next 3-4 months and see whether everything is going well. If it's going well, then it stops, right? So that's the solution. Now, to develop that solution, the elements that we need is actually there. So it might sound like a science fiction, it's not. It's already there in Bangladesh in most of the cases. We now need to create the policy framework to develop the infrastructure in terms of the interoperability, in terms of getting some of the investments in the right places. But I think the problems, the solution, if the solution looks like this, the challenge is to build a proper policy framework to help that.
Thank you. And Leslie, to you, any suggestion, what should we do, or what are the problems we are facing now in Bangladesh, of course, related to India also, because we are same kind of people, same kind of culture following people. So what your suggestion is?
My simple answer is go back to your basics. Community healthcare is your strength. Community movement is your strength. Now, develop primary and preventive care. Because every healthcare seminar that I go everywhere, they all talk about developing preventing and primary healthcare. And if you look at WHO reports, you will find that the preventive and primary healthcare definition has undergone massive changes. So when you are talking in terms of NCDs, which is on the rise both in India and in Bangladesh, NCDs are necessarily, they are chronic in nature. And chronic treatment requires a different kind of protocol altogether. Different kind of settings altogether. And hospitals, unfortunately, are not the right places to treat NCD. You require home cares, you require in plenty subacute care that has not taken place in either Bangladesh or in India. I have seen some home cares springing up in India. So those kind of institutions need to be developed, because that's those institutions can take care of a very big and sizable population. Now, I was looking at the HAC index. HAC is Health Quality and Accessibility Index. And I found Bangladesh is somewhere between 133 position out of 195 countries. India is even worse. India is at 143. Now, HAC is what? They look at 33 diseases, important diseases, and based on those 33 diseases, they find out solutions. All that we need to look at in Bangladesh is look at those 33 important diseases that affect your society, that affect your community, and start working on that. And as Madam said, that IT, information technology, is a great enabler. Only thing, IT has to be relevant. It has to change with the change of the time, because IT also becomes irrelevant at times. It's the speed and change is so fast at times that it's very, very important for technology to also remain relevant. So my simple idea, I look at it that go back to your primary healthcare, go back to your preventive healthcare, and primary and preventive healthcare can bring down 70% of death cases, or they can delay it. And those are empirical things. So the research has to take in those places. The other issue there, create good experience. If you cannot create good experience, you are not going to survive in this business. Create touch points. What do we call moment of truths? When I go to a hospital, my experience goes sour. Even if a billing desk, my whole experience goes bad. So right from billing desk to surgery, the doctors, the interaction with the nurses or other healthcare people, all these are very, very important. Now, when I look at the primary healthcare system, if it has to be developed and it has to be made more resilient over a period of time, do you know the kind of employment it can throw up? It can throw up huge employment. And a country which struggles to address unemployment issue possibly is not looking at that. So looking at the employability that it can throw up and also the way it can bring down the health problems, these are the two areas. That's the reason I said, go back to the basics, start addressing the basics, and then leverage technology to address the basics. That's simple sounds, but I think there lies the solution.
Thank you so much. Actually, we are actually at the end of our panel discussion. Thank you everybody for being with us, and it was a very nice conversation where we could learn something and could feed our thought to improvise our health system also. So I should wrap up with some conclusion what we got from you. That is, first of all, we must be updated. What is going around us? আমাদের চারপাশে কি হচ্ছে সেটা আমাদের জানা দরকার। আমরা যদি হেলথ টেকনোলজি এইসব জিনিসপত্র সম্পর্কে আসলেই জানতে চাই, কাজ করতে চাই, নিজেদের আপডেটেড রাখতে হবে। কারণ শুধুমাত্র বহু পুরোনো আমলের একটি এক্সরে মেশিন অথবা শুধুমাত্র মোবাইলের মাধ্যমে স্বাস্থ্য ব্যবস্থাকে উন্নত করা এটাই হেলথ টেকনোলজি নয়, এর আরও অনেক ব্যবহার রয়েছে, সেটা সম্পর্কে আমাদের আপডেটেড নিজেদের রাখতে হবে। এবং আমরা সবসময় রিসার্চের ব্যাপারে বলি need assessment. What we are trying to do, first we have to assess our community. First we have to assess our people. আসলেই তাদের এই জিনিসটা দরকার কিনা। যেমন আমাদের প্রফেসর অভিজিৎ যেটা বলছিলেন যে আমাদের প্রাইমারি কেয়ার এবং প্রিভেন্টিভ হেলথ কেয়ারের দিকে নজর দেওয়া উচিত, কারণ সেখান থেকে আসলে মূল স্বাস্থ্য ব্যবস্থাটা শুরু হয়। সো তাদের আসলে কি প্রয়োজন, সেখানে কোন জিনিসটা দিলে কিভাবে তারা নিজেদের স্বাস্থ্য সম্পর্কে জানবেন, নিজেদের সচেতনতা বাড়াবেন, সেটা আমাদের জানতে হবে। এবং এই জন্য দরকার তৃতীয় যে পয়েন্টটা, এডুকেশন। সাধারণ শিক্ষার পাশাপাশি স্বাস্থ্য শিক্ষাটাও জরুরি। স্বাস্থ্য শিক্ষিত হওয়া মানে যে সে এডুকেটেড হবে, তার প্রাতিষ্ঠানিক সার্টিফিকেট থাকবে এমনটা নয়, সচেতন হতে পারে। বাট একজন মানুষ যখন এডুকেটেড হবে তখন আমরা ধরে নিতে পারি তিনি তার স্বাস্থ্য সম্পর্কিত যেসব প্রচারণাগুলো সরকার কিংবা বেসরকারি পক্ষ থেকে আসে সেগুলো তিনি পড়তে পারবেন এবং সেটা তিনি জেনে নেবেন। সেই ক্ষেত্রে টেকনোলজি আমাদেরকে সাহায্য করতে পারে। এবং এই হেলথ এডুকেশনটা শুধুমাত্র যে কনজিউমার লেভেলে হবে তা না, আমরা বলতে চাইছি বোথ ওয়েতে হবে। যিনি প্রোভাইড করছেন তিনিও শিখবেন কি আসলে আমার কনজিউমার চায়, যার কাছে আমি আমার এই সেবাটা বিক্রি করছি, সেবাটা পৌঁছে দিচ্ছি, তার আসলে কতটুকু প্রয়োজন এবং কীভাবে দিলি তিনি সেটা নেবেন, তিনি সেটা ব্যবহার করবেন। রিডিউস দ্য কস্ট ওয়াজ অ্যানাদার পয়েন্ট, যে আমরা শুধুমাত্র বলেই যাব এবং শুধুমাত্র যেই মূল্য আমরা এই হেলথ সার্ভিসের জন্য চাবো সেটা না, এটা কমিয়ে আনতে হবে। এবং এক্ষেত্রে বিভিন্ন রকম ব্যবস্থাপনা হতে পারে, কোথাও বেশি কোথাও কম, যেটা যেভাবে অ্যাডজাস্ট করার চেষ্টা। এবং আমাদের এখানে যেসব উদ্যোক্তারা রয়েছেন তারা চেষ্টা করছেন অবশ্যই এটাকে কমিয়ে আনতে। তারপরে যে বিষয়টি উঠে এসেছে সেটি হচ্ছে স্ট্যান্ডার্ড। প্রত্যেকটি ক্ষেত্রেই আমরা অনেক কাজ করি, কিন্তু সেটার যদি একটা নির্দিষ্টতা না থাকে, একটা মানদণ্ড না থাকে, তাহলে সেই জিনিসটা শেষ পর্যন্ত দাঁড়ায় না। আমরা অনেক ক্ষেত্রে অনেক কাজ করে যাই, কিন্তু একই কাজ হয়তো অনেকে মিলে করছি, যদি সেই নির্দিষ্টতার মানদণ্ডতা না থাকে তাহলে সেই জিনিসটা শেষ পর্যন্ত সাফল্যের মুখ দেখে না। এবং এমনও হতে পারে যেখানে আমরা শুরু থেকেই বলছি ট্রাস্টের একটা বিষয় থাকে, বিশেষ করে হেলথ ইন্স্যুরেন্সের ক্ষেত্রে আমাদের ট্রাস্টের অনেকখানি দুর্বলতা রয়ে গেছে। আমরা নিজেরাও কাজ করতে গিয়ে দেখেছি যে মানুষ মনে করেন ওই যে সময়টা বেশি লেগে গেল তাতেই হয়তো তার মনে হয় এখান থেকে আর কাজ করা যাবে না। সেই বিশ্বস্ততা অর্জন করতে হলেও আমাদের একটা মানদণ্ড প্রয়োজন। রুবা বাপার কথা থেকে যেটা উঠে এসছে যে আমরা এখন বলছি হেলথ টেকনোলজি এটাকে ব্যবহার করব, পাশাপাশি ডিজিটাইজেশন করব, আমাদের যত প্রযুক্তি আছে সেখানে আমাদের স্বাস্থ্য সম্পর্কিত সমস্ত তথ্যগুলো সংরক্ষিত থাকবে। এই সংরক্ষণের বিষয়টা এবং নিরাপত্তার বিষয়টাও জরুরি। ভরসা যদি না করা যায়, আমাদের উপর বিশ্বাস যদি না করা যায়, কেউ মন খুলে তার সমস্যার কথা বলবেন না এবং আমাদের কাছেও অ্যাকচুয়াল যে ফিগারটা, যে তথ্যটা, সেটি আসবে না। সবশেষের জরুরি কথা হচ্ছে পলিসি মেকিং। আমাদের যদি নির্দিষ্ট কোনো কৌশল, কোনো নীতিমালা না থাকে, তাহলে আমরা যতই চেষ্টা করি না কেন, শেষ পর্যন্ত সেটা ভেস্তে যাবে। এবং এই জন্য আমাদের সরকারি, বেসরকারি এবং যে যেখানে কাজ করছি একসাথে হতে হবে। কারণ একই সঙ্গে যদি একই কাজ আমরা ভিন্ন ভিন্ন প্ল্যাটফর্ম থেকে করি, সেটাও সরকারের কাছে অবধি পৌঁছাবে না। আমরা যেটা করছি, আমরা একে অন্যকে সাহায্য করতে পারবো না। আমার কাছে যে তথ্যটা আছে, একজন আরেকজনের সঙ্গে যদি আমরা সেটা ভাগাভাগি করে নিই, তথ্যটা বিনিময় করি, তাহলে প্রত্যেকের জন্যই সেটা লাভবান হবে। তারপরে আমরা একটা সুনির্দিষ্ট নীতিমালা তৈরি করার জন্য সরকারের কাছে এটা প্রস্তাবনা পেশ করতে পারবো, যাতে করে তারা আমাদেরকে, অবশ্যই আমরা মনে করি যে হ্যাঁ, সরকার সব ক্ষেত্রে আমাদের সরকারের কাছে প্রস্তাবনা দিতে পারি, অবশ্যই আমরা এক্ষেত্রে সফল হব। আপনাদের সবাইকে আন্তরিক ধন্যবাদ জানাচ্ছি। আর সময়ের স্বল্পতার জন্য আজকে প্রশ্ন নিচ্ছি না, আমাদের প্যানেল ডিসকাশনটা এখানেই শেষ করছি। আপনারা যারা এতক্ষণ আমাদের সঙ্গে ছিলেন, অসংখ্য ধন্যবাদ। থ্যাংক ইউ অল। Now I would like Ms. Farzana Chaudhary, on behalf of GD Assist and Green Delta Insurance, to hand over the crest to our panelists. May I have our volunteers to provide the crest here? Farzana, okay. May I request Mr. Moin, please, to come over the dais and hand over the crest to...
Let me just help you out. We would like to request Ms. Farzana Chaudhary, Director GDSS and CEO of Green Delta Insurance, to hand over the crest first to Professor Abhijit Chaturaj, please. Professor Abhijit Chaturaj. Farzana Appa to hand over the crest. Now I'd like to request Farzana Appa to hand over the crest to Rubaba Appa. Now to Sajid Bhai, Sajid Rahman. Now to Silvana, Brava Health. Now request Farzana Appa to hand over the crest to our moderator, Dr. Natasha. Now request Rubaba Appa to hand over the crest to Farzana Appa. Can we have a photograph with the crest, all of you, please? Thank you. Thank you so much, everyone.